Hello, how are you today?
I'm good, how are you?
Good, my name is Teresa. I'm a physical therapy assistant student at Penn State Hazleton. Is it okay if I work with you?
Yes.
All right, can you just verify your name and date of birth?
My name is Haley Watkins, 12/28/04.
Okay, do you know where you're at today?
Penn State Hazleton.
Okay, and do you know the day of the week?
It is Thursday.
Perfect. Okay, so I was just reading your chart here, and I can see that you had a meniscus tear a couple days ago and you got surgery.
Yes.
Okay. And so today we're just going to be doing some EMS. So it's this machine. It's going to help with the muscle contractions. It's going to improve your muscle strength and performance, and then you're going to expect to feel a muscle contraction, twitching. It's going to be strong but comfortable, but it shouldn't be painful. If it's painful, let me know, and we'll stop and we'll kind of readjust the parameters that I put into the machine.
Okay.
Okay. Okay, so before I get started, I just have a couple questions. Your active motion is not contraindicated, so we are good. Do you have any cardiac pacemakers?
I do not.
Okay, do you have any superficial metal implants or other stimulators in there?
No.
Okay, and you are oriented, so we can continue. I wouldn't apply it to the gravid uterus, and there's no active bleeding in the area, or there's no malignancy.
Correct.
All right, and then your skin isn't anesthetic skin, okay?
Right.
We're gonna avoid the open wounds there. You don't have any. We're gonna avoid areas of extreme edema. There's no heavy scarring or adipose tissue in there. Do you use chronic use of corticosteroids?
No.
No? Okay. I wouldn't place the electrodes over your larynx or pharynx muscles or near your carotid sinus or your eyes. And if you feel uncomfortable, just let me know. We're not gonna apply it where you feel uncomfortable.
Okay.
Okay? All right. So, I do have more questions.
Okay.
On the scale 0 to 10, 0 being no pain, 10 being as worst pain imaginable, how would you rate your pain today?
I say like a 3.
A 3? Okay. And then can you point to where that pain is? I believe it's in your left quad, correct?
Yeah, it's like kind of like right.
It's like right there. Okay, I'm
Yeah.
gonna palpate that. Is that
Yeah.
a little weak? Okay.
Yeah.
All right, and I can see your muscle grade is a 2.2 plus out of 5, so we'll definitely get that strong contraction there. Does this impact your daily living activities?
Yeah, I think like pretty much anything with walking.
Okay.
Especially going upstairs is pretty hard.
Okay, it's a little weak.
Yeah.
Okay. All right. Prior to this injury, were you more independent?
Yeah, I was
Less
so-
inde-
I
yeah,
was
more
definitely
independent?
independent.
Okay, and what are some goals in physical therapy that you would like to get back to doing?
Well, I was a softball player, so I'd like to get back to softball.
Very nice, very nice. We'll try to get you back next season.
Mhm.
And are you currently in work?
I am not.
Okay.
Yeah.
Okay, that's okay. So now we're gonna do a sensation test. So this is gonna be light and this is gonna be deep.
Okay.
Okay, so I'm just gonna apply those sensations and then you're just gonna let me know what you feel. So I want you to close your eyes and turn the other way, look at our patient over there. Okay, so let me know what this is.
Light. Deep. Light. Light. Deep. Light. Deep.
Perfect, and do these feel the same?
Yes.
And what is this?
Deep.
One. Deep. Okay, perfect. So your skin is good. I'm just gonna check your range of motion. So if you can just extend that knee a little bit more and then lift it up. Oh, yeah, definitely weak, definitely weak. So we'll definitely get back to doing that. I'm gonna inspect your skin. I don't see any abnormal things going on, and then I'm gonna look under. Okay, perfect. All right, so I am going to clean your skin here. Hi, therapist. How are you?
I'm good, how are you?
Good.
Have you seen my back?
Oh yes, your stuff is right here. Yep, you can come in. We're just working on EMS.
Oh, nice.
Yes.
Is your first time doing EMS?
It is, yes.
Oh, okay, that's exciting.
Yeah.
It's fun.
I'm a
She's
little
ready.
I'm a little nervous,
Yeah.
but I
Yeah.
think it'll be good.
Don't be nervous.
Yeah.
Again, strong but comfortable, no
You have
pain.
a very good therapist working with you today. so.
Good to know. Good to know.
Bye, Mr. Peyton.
We'll see.
guys. Okay.
And there's Mr. Joseph back there.
Oh, hello.
The camera's not on me, but
Okay, so I'm gonna clean the skin here, and then we have Mr. Roth over here. Okay, I'm gonna also give you this call bell. just in case I'm like over here working with Peyton and like you need to get me. Okay.
Sweaty.
You could work
Okay.
on documentation.
Yeah.
Yeah.
And then I'm going to put this underneath your back of your knee.
Okay.
So then when you feel that contraction, you're just going to squeeze into that towel. Hold while the EMS machine is working.
Okay.
So we can get the isometric contraction there. All right. So if you can just show me that just so I know you can do it. Perfect. Okay. So I clean the skin. I'm going to start off with tetany on constant mode so I can find that number. So I'm gonna just untangle this little mess here. Oop, sorry. Okay, so I'm going to put one channel here. Okay, and then I'm gonna put the other channel here. All right, so I'm gonna set my parameters on the constant. I'm gonna set your rate to 20, and then I'm gonna set your pulse width to 250. Okay, and I'm just going to find that. I'm just gonna turn up the intensity, find where where it's strong but comfortable.
Okay.
Okay, so on the one side, you're just gonna let me know if it's. Feel anything?
I feel a little bit.
Okay, let me know when it's strong but comfortable.
I think that's good.
Okay, and then the other side.
Yeah, that's a lot.
Okay, okay, all right. Perfect. I'm gonna turn back down. I got my number. We got 3.
Okay.
Okay. Now I'm going to put it on synchronous mode, and I am going to we're gonna do some unfused tetany because you have a 2+ out of 5 muscle grade. So I'm going to put my ramp to 3. I'm gonna put my on time to 16 seconds, and then my off time is 80 seconds. And then your pulse width is 250, and your rate will be 20. And we will set this for total of 16 minutes. Okay. So at any time you feel the contraction, you're gonna do that quad set for me and hold every time it comes on. Okay, so I am just going to put it up to 3, and you let me know when you start to feel it. Okay. How is your day going today?
It's pretty good.
Good,
Yeah,
very
nothing,
good.
nothing exciting.
Okay.
Yeah, how's yours?
It's going good.
That's good.
No, it's been busy in the clinic. So.
Yeah, I can tell. Yeah.
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 Too many people in here,
Yeah.
but it's almost the weekend, so
It is. It's
yes.
almost the weekend. Do you have any plans for the weekend?
Just hanging out with my kids, you know.
Okay.
Yeah.
Very nice.
Yeah.
Very nice.
How about you?
Yeah, I don't really have any plans. My parents are coming to visit.
Very
That'll be
nice. Very nice.
Yeah.
All right. So you should be feeling it. Oh. Do that quad set. Squeeze it. Good. Good. Painful.
No.
Strong.
Yeah.
But comfortable.
Yes.
Okay. All right. 16 seconds. All right. Yep. Keep squeezing. And we're gonna do 10 of these. Okay. Good. Okay.
Yeah.
So we did 10 reps. So I'm going to turn this down. I'm gonna turn it off. So for your home exercise program, I do want you to do those quad sets. Okay, so you're going to get like a towel, a pillow, squeeze, and then hold for 6 seconds. You're going to do that 10 times. And do you have an EMS unit at home?
I do.
Oh, perfect. Okay, so after this, I will write down the parameters, what we did in the clinic, and you're going to do the same exact thing at home. and I want you to do that once a day until you come see me again. Again, if you have any pain, just stop and we will reassess the next visit. And you may feel it might be strong, but nothing painful.
Okay.
All right, so I am going to, okay, so on a scale of 0 to 10, how would you rate your pain? 0 being no pain, 10 being the worst pain.
I'd say like a 1.
A 1? Okay,
Yeah.
so it definitely decreased.
Definitely.
Good job.
Yeah.
Okay, I'm going to just palpate the skin, looking good. And then I just want you to try to do that range of motion again, bringing it up.
Oh.
Very good, very good, very good. All right. Okay, and your skin looks good, and you're all set. Do you have any questions for me?
I do not.
Okay, well, thank you for letting me work with you. Have a great day. I will see you at your next visit.
I'll see you then.
Perfect, thank you.
Thank you.